Hello.
Yeah, Madhura, please go ahead.
Yeah. Uh, First of all, thank you so much, Dr. Fatima Shameen, ma'am, for consulting to be speaker for us and helping us understand the exploring role of clinical pharmacists in changing healthcare system. I would like to thank you everyone who joined the session today. I would like to introduce Dr. Fatima Shameen, ma'am. Dr. Fatima Shameen, ma'am, completed her Doctor of Pharmacy in the year 2019 from Grace College of Pharmacy, Palakkad, Kerala. After that, she is working as a clinical pharmacist in anti-tuberculosis treatment stewardship program at Amrita Institute of Medical Science, Kochi. She is also working as a research assistant in a project titled Epidemiology and Preventability of Hospital Onset Bacteremia and Fungimia in India study. The study is a collaboration with Washington University School of Medicine. Apart from job, ma'am have a social media life where she always try to reach out to people through excellent work. Ma'am do have a YouTube channel named as that is Pharmacy Point, where she shared really very interesting and useful YouTube videos like how to calculate insulin dose, a complete information regarding glycopeptide antibiotic, tetracycline, and also also give a brief introduction on wrong ways to take tablet or pills or capsule. She is passionate about learning new things. According to ma'am, knowledge should not be hidden, it should be shared to inspire and enrich everyone around us. So we are really very glad to have you today, ma'am. Eager to listen and learn from you. And thank you so much. Hello.
Good evening.
Yeah. Good
Hello,
evening.
everyone. Good evening. That was a very sweet introduction. And I'm also glad Dr. Karthik sir has given me this opportunity to speak with you all. So I'm really happy. So this is going to be an informal talk because here I'm going to share my professional journey and some new opportunities for clinical pharmacists in hospitals. So can I start now?
Yes, ma'am, please go ahead.
Yeah, okay. So, like I just passed out in October 2020, my internship was over, Pharm.D. And then I was third batch in my college. So my seniors passed out when I was in fifth year. So what happened is that we know, right? Like when I joined the course, I didn't have any idea. I was like some of you people who didn't have any idea regarding the job opportunities after Pharm.D. Just know there is something called clinical pharmacist, or else you can go to any other fields like industrial or like drug safety. So some vague knowledge was there about all this. So once our seniors passed out, we came to know that like only one or two of them got job as clinical pharmacists and rest of them started trying out in teaching or like they went for pharmacovigilance or different job opportunities. And I really wanted to become a clinical pharmacist, and this was really sad for me. And during my college years, we really hear a lot of negative. I think still now also you hear about this. There are no job opportunities. There are less job opportunities, and so many such negative things go around. So this really stressed me like any other student. Even I also had this. I was also really sad about this course and all that. Then slowly, what I did is I tried to deviate myself from this. Look, even I didn't have a good clinical exposure from during my internship years, so I didn't have any idea like how will I become a clinical pharmacist with like least amount of clinical exposure, and what will I do? I was really confused. So I just shifted my entire thoughts and I deviated from all that negative thinking, and I then came to think about learning things differently, learning different concepts in a different way. See, like for exams, what we do, we usually prepare notes which are like very simple, maybe 10 points regarding a topic. So we study in an exam point of view, like how can we score marks, what all points we should write. But there is a different way of learning where, you learn the concept in depth For example, I'll give you a simple disease like hypothyroidism. So this is thyroid disorders. It's a chapter I think we learn in second year under pharmacotherapeutics. So we know during hello.
Sorry to interrupt you. Actually, we lost your screen. Can you reshare your screen again?
Okay. Okay, can you see me now?
No, ma'am, screen is not visible.
Okay, one second. Actually, I have switched on my cam. So is there any other option?
No,
Yes, ma'am, we can see you.
You can see me,
We can
right?
see you, ma'am,
Yep,
but you
yes.
have to share your screen, ma'am. You have to click the share on your screen and you have to select the window you have to share, and then you can open the PPT.
No, actually, I will open the PPT after some time. So that's why
Okay, then
I
please
just
go ahead.
okay, yeah, okay. Yeah, so I was saying there are two different ways of learning. So one is exam point of view, the other way is different way. Like for simple example, hypothyroidism. So we know what is hypothyroidism. The patient will have low levels of T3, T4 hormones. They suffer from fatigue, lethargic. They have like dry skin. They get brittle nails. They get constipation. So we just learn like some fixed points. So do you know like hypothyroid patients also become anemic? So that is also one symptom. So I still remember I asked myself, like, how can a hypothyroid patient be anemic? Even he didn't have an idea that time. He told, let me refer and tell you. So I don't know whether any one of you know about this. Do you know, like, hypothyroid patients also have low HB levels in their blood? So yeah, maybe some of you know, some of you don't know, but I didn't know that time. So that kind of information you won't get from books. This thyroid hormone is also involved in red blood cell production. Thyroid receptors are also present in bone marrow. So this is not there in textbooks. Then from where will you get this? You will get this only from articles. So when you try to learn something in a different way, like just go behind the whys and hows. We know like doxycycline cause photosensitivity reaction. Okay. How does they cause? Why do they cause photosensitivity reaction? So such kind of questioning, something which we learn will help us to like investigate deep, and it brings an interest for us. We have to be curious to learn these things. So I kind of deviated that entire learning method into this. I tried to learn things in a different way. So I just focused on learning. So finally, after all that learning done, and after my internship, during my internship years, I started the LinkedIn account, and I tried to connect with a lot of Pharm.D graduates who were working in different fields. And I tried to communicate with them. I tried to understand like how did they get that job? What were the efforts they put to get that job? What were the skills required? Now, where are they standing? And all that, because like any graduates, we were tensed and all that. So I literally went on connecting with a lot of people and got to know about a lot of job opportunities. Then what I did is, since I told you I started learning deep, I started making infographics. Like for example, let's take a drug, metformin. So metformin has different kind of indications. It's given like after food or before food. So with little pictures and an interesting catchy way, I started making infographics related to drugs and diseases. So this I started posting in LinkedIn, and I really got a very beautiful reach. So slowly everybody started recognizing me, and then I started a YouTube channel. So it was not this channel which now I'm having. I had a channel before. So in that I used to share foreign licensure exam procedures, which is actually available in every website, and I just read them and I just presented in my own way. So like that I got recognized in LinkedIn and everywhere, and slowly I was also searching for jobs. And then one of my friend, she's like a connection. I know her personally. She was from Amrita Institute, and she just said there is a job opening and your salary is going to be this. If you're interested, you can send CV. So I had sent my resume, but I never hope that they will take me, because Amrita Institute is like a big medical college, and they're having their own pharmacy college. They have their own Pharm.D graduates. Then why should they take someone from outside? So I was hopeless, but I shared. And then October, I still remember October 2020, I passed out. But within December, this call came, interview call came that I had to join by JAM. And I was so glad that I got this job. And like, how did I get this job? Is during my internship year, right during intern 5th year, we have a project. So I managed to publish 3 articles. Before I graduated Pharm.D, I managed to publish 3 articles. And so when they compared their CVs from the students who were studying there, that much publication was not there. And I had more number of articles presented in my name. So that was one of the reasons they picked me from all those students. They picked me for this job. So here I will talk about the importance of research, mainly focusing on research and other clinical pharmacy activities which we do in our hospital. Okay, I'll share my screen. Okay, so can you see my screen?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay, so this is our topic, exploring the role of clinical pharmacist in a changing healthcare system. So these were my publications, which I did in 2018. My project was focused on obstructive lung disease and asthma, all that pulmonary restrictive disorders, and mainly pharmaceutical interventions and identifying drug-related problems. So I managed to publish 3 articles. This is like my previous publications. Okay, coming to the role of clinical pharmacists. So during our internship years, we know what does clinical pharmacists do. So traditionally, they go for ward rounds with doctors, or they go for self-ward rounds, take prescriptions, check for rationality of the prescription, provide drug information services, do a clinical review, provide patient counseling, monitor drug interactions, adverse drug reactions, and report them. So this is something which everyone knows. Now I'm going to introduce you all to something new which we do in our hospital, or maybe it's also done in more number of hospitals. Okay, so clinical pharmacist has an important role in antimicrobial stewardship, clinical research, in manuscript preparation and publication. They are also involved in national and international projects. They provide presentations to the healthcare team. They're also involved in preparing protocols and guidelines. So just giving you a brief idea on these topics. So antimicrobial stewardship, I'm sure most of them, you know that it's a team of ID physicians, clinical pharmacists, a hospital epidemiologist, microbiologist. So it's just a team. So what clinical pharmacist, the main aim of antimicrobial stewardship is to prevent adverse drug reaction, optimize the antimicrobial use, and contain antimicrobial resistance, and reduce the unnecessary cost involved in the purchasing of antimicrobial agents. So drug resistance is something which is very we have heard it like, there are antimicrobial resistance going on. But, I have literally seen so many blood cultures, even, neonates, less than 2 months, they're just born out of their mother and they get multi-drug resistant Klebsiella pneumoniae in their blood. No idea from where does this pathogen enter. So such high level of antimicrobial resistance is seen. So for reducing all this, an antimicrobial stewardship committee plays an important role in a hospital. So they track, especially in case of reserved antibiotics. Reserved antibiotics are kind of higher end antibiotics. So they should be used carefully. We cannot prescribe them for every patient. We prescribe them for only a particular a category of patients, like if they really, really require. Because if we start misusing reserved antibiotics, what happens is when we get multi-drug resistant organisms, nothing will work against them. So that's why we have to use them with lots of caution. So here, clinical pharmacists, what they do is they track the patients who receive this reserved antibiotics. Reserved antibiotics, it's like meropenem, linezolid, clindamycin, all this kind of drugs, colistin, polymyxin, all this kind of drugs are reserved antibiotics. So clinical pharmacists, what they do is they track these patients, they collect the cases, they check for inflammatory markers, whether this patient require this antibiotic, they check for blood cultures, how is the culture and sensitivity pattern for this particular organism. So in that way, they check the prescriptions, and if they find any error, we discuss these cases to infectious disease doctors, like doctors which are specialized in this. So sitting with the doctors and discussing this, and if there is any error, we provide recommendations to these doctors who have prescribed, to those primary care physicians who have prescribed these drugs. So antimicrobial stewardship is a very important program where CP play a major role. Now, how to check the prescription is right or not? It's the rationality, like right indication, whether it's according to the diagnosis of the patient, culture and sensitivity report, right drug, right dose, right frequency, right duration. So I think you all know this. Now we make guidelines. So we help doctors in preparing guidelines, and most of our antibiotic, especially the dosing of reserved antibiotics, is based on these standard guidelines, which is basically from US. So based on these guidelines, we refer, and according to our antibiogram, we check for the, like according to our infectious disease department, whatever antibiogram is available and the culture and sensitivity pattern, we prescribe the drugs. Coming to anti-tuberculosis treatment stewardship. So this is something new. Even I didn't know what was this. I was directly appointed for this team. I had done a number of online courses. So regarding TB, I had done one course. But anti-tuberculosis treatment stewardship was something really new. And I think this is done in our hospital only. So this is where we concentrate on drug-sensitive TB. So there are many types of TB, and India is one of the country with high burden tuberculosis. So here we have national guidelines. India has national guidelines, that is RNTCP, or you can say National Tuberculosis Elimination Program. So that we have standard set of guidelines. So what we do is we track TB patients. Again, tracking the patients and collecting cases is the job of clinical pharmacist. So we track patients who take first-line anti-tuberculosis drugs, and then again we discuss with a pulmonologist and a general physician if there is any error in the prescriptions. Now, I will tell you why this error comes. Usually, there are a number of errors in anti-tuberculosis treatment stewardship. So, this is an article which we published from a hospital regarding anti-tuberculosis treatment. It's available in public. If you just type this, it will be available. If you can read this. Okay, so these are the 4 drugs: isoniazid, rifampicin, pyrazinamide, and ethambutol, which is given for drug-sensitive TB. So these drugs are like very, very important for like preventing tuberculosis or killing the pathogen, because if patients becomes resistant to these drugs, treating TB becomes a problem. So that's why we have to be very careful while dosing these drugs. So TB drugs are usually dosed based on patient's body weight. So this is according to standard guidelines. If it's isoniazid, we need 4 to 6 milligram per kilogram. So we have a set of dose range. So what we do is we check whether patient's body weight, according to the body weight, did the doctor prescribe these drugs. So sometimes there will be errors in those errors are there sometimes. So that's how we do. And AKT4 is a drug which is provided by the government. It's a combination. It's like fixed dose. So I've just showed this. Okay, so we have a combination of isoniazid and rifampicin, plus we have all these individual drugs in different doses. So based on our available doses and based on patient's body weight, we calculate the dose required. Just a simple example, if the patient is 70 kg, so as we saw before, his dose range will be 8 to 12 milligram per kilogram. So here we got his dose range as 560 to 840. So for this patient, his dose should be something in between 560 to 840, that is 600 mg. Coming to another drug, pyrazinamide. So here you can see it's 14,000 to 1,400 to 2,100 milligram per kilogram. So here for this patient, he required 1,500 milligram at least. So body weight is really important, then only the drug will work and it is will be equally distributed. So here you can see we don't have 1,500 milligram as such as a dose. So available dose is 750. So we prescribe like take 2 750 tablets. So this is how we check for and tuberculosis treatment prescription. This is how we check the dose and even the frequency, how it's prescribed, whether it is prescribed before food or after food. So usually rifampicin, isoniazid acid is better to be taken like before food, and rest of the drugs like after food. And there are so many diagnostic guidelines, so I don't want to go through that. We have to keep on monitoring these patients because chances of liver toxicity is high. Maybe you take 10 patients, at least 5 of them will have elevated liver enzymes. So we have to continuously monitor these patients. That is all about antimicrobial stewardship and anti-tuberculosis stewardship. Next is protocols and guidelines. So CPs are also involved in antibiogram preparation. So antibiogram is culture and sensitivity of common pathogens, which we prepare according to our local setting or whatever pathogens we see in a hospital. So this will be prepared, and based on that, it will be helpful for doctors to prescribe, especially empirically prescribe antibiotics. Then we also prepare standard dosing guidelines for reserved antibiotics, indication-based treatment guidelines, then IV dilution for reserved antibiotics, stability protocols for pediatrics. Then Candida auris or candidemia is a fungal infection in blood which occurs usually in a hospital setting. So usually the patient will get this condition from hospital. So we have a checklist for that, like to check how does this happen and all that. Then surgical site infections, this also happens in the hospital. We have a specific protocol for that. Then hospital acquired infections. So this is something which is mostly seen in IP patients. They get hospital acquired infections. So we go for root cause analysis. So here you can see CPs working to improve the quality. They're working in an administrative side to improve the quality of care for the patient. So they track hospital acquired infection. For example, there is something called CLABSI. I don't know if it's new for you. It is central line associated bloodstream infections. Similarly, COT is catheter-associated urinary tract infection. So these conditions come from the hospital itself. So we kind of check the patients, like from where did they get this kind of infections. We monitor their blood cultures, urine cultures. So this is all done by clinical pharmacist. Then we also check for ventilator-associated pneumonia, then appropriateness of central line. So central line is something which even I didn't know when I was studying, but when I came to this job, I started learning all new things. But central line is something where chances of bloodstream infection is more when the pathogen enters through central line. So something which is placed for giving drugs. And we also check for hand hygiene, whether the hand hygiene is maintained before touching the patient, after touching the patient, and all that. So this is something which is related to improving quality of the patient. Now coming to international and national projects. So Amrita University has a lot of international and national projects. Just giving you just explaining 3 of them. So Prevent It is, if you search this, if you Google it, you will get the details. So Prevent It is a project. It's funded by Erasmus program of European Commission. So here they address the issue of antimicrobial resistance. Coming to a next project is antibiotic use across surgical pathways. So usually this project focuses on optimizing antibiotic usage along surgeries. So this also addresses antimicrobial resistance and also trying to improve clinical outcomes. So this is in collaboration with Imperial College London, University of Cape Town, King's College London. So even there are 8 universities working under this project, including Amrita Institute. Now coming to my project, I am the one who is working in this project. This is epidemiology and preventability of hospital onset bacteremia, fungemia in India. And this is in collaboration with our principal investigator. One of our principal investigator is from Washington University, St. Louis. So this is a project where we track down blood cultures. We just track down blood cultures which are positive, and among those blood cultures, how many of them are from hospital acquired, and whether is it preventable or not. So that is my project. So look, I'm not during my internship years, I didn't know anything, nothing about this project or central line or how to check blood culture, whether it is hospital acquired. We didn't have any idea. But once we enter a job, we start learning a lot of new things. So this project was a very good exposure for me to learn a lot of new things which I didn't know about. Coming to manuscript and publication. See, So we have international and national projects going on in our hospital. So even if you don't have, if you're not working in any project, you can still write a manuscript and publish. So general structure of a research article, this also you will get if you read articles. So start reading articles. Look, your students, if you start reading now, you will get that interest. Whatever, like if you see a new case report, you should have that interest to write about it and publish. So publishing your articles is something very important. It will be there forever. If somebody types your name, if you have published an article, your name will appear there that you have published something. So this is something which is very important. It will make you stand out from others. Seriously, this is one point. So try to write narrative review, scoping review. This is something which you can do. You don't need any institution or big people behind this. You just have to read a lot of articles and make a conclusion or give a narrative presentation by yourself. So, or if you're in your internship years, if you see some rare adverse drug reaction, you can even write a clinical case report. So this is something which you can do as students now. So this will be really helpful if you're planning to get a job in a hospital setting or anywhere, let it be anywhere, having publications in your name is really, really, really useful. So how do you read articles? How do you search them? So these are some online journal and research databases like PubMed, Google Scholar, ResearchGate. So any article you type, you will get. This is like a search engine for articles. So I know most of them know about this. So through this, you can search and read about articles. Coming to publications. So these are some publications where clinical pharmacists have done work in this and have published. So this is published from Amrita. You can just read it. Yeah. So so that's all in my presentation. I think I talked fast. So only thing I want to share is, I know most of you are worried, like whether you will get a job, whether I will get enough salary, or whether I'm going to, whether I won't get job or anything. So you don't need to worry about all this. See, if you're someone who is like before your internship, if you're students, is try to, as I said, you try to learn things in depth. This will really help. If somebody asks you something, you will be able to give them an answer like immediately, because you have learned that concept, you have mastered that concept in a different way if you learn it deeply. So I told you, right, I didn't have a clinical exposure, but what I did is I empowered myself through self-directed learning. I started reading articles, I started learning by myself. So this has helped me to get a job in a very good university, a research exposed university where they're having their own Pharm.D students. And look, I got a job just because I started learning a lot and I did publications and all that. So try to read articles, develop a research interest. When you study something, always think, why does this happen? How this happens? So when you have that interest, you will start searching, why does this happen or why that happens? So when you try to learn things like that, it will be more easier for you. So just chill, focus on your studies. And if you're someone who is in your internship years, you can try LinkedIn, try connecting with people, try talking with them. If they are from a different field, you don't know, you can talk with them. Most of them will help you in LinkedIn. They will tell you about their profession. So this is what I did and this is what helped me. And don't worry about your salary. See, I'm not earning a very high salary, but I am in a job where I'm getting a lot of opportunity to learn new things. So initial phase of your years it's like career building. Initial years, it's like your career building. So whatever job you get, initial years, you're actually exploring. You're still exploring. You will be never stuck in that job. You're still exploring your opportunities. You'll be learning new things. You'll be gaining new experiences. So this is like finding new opportunities. So don't worry about your salary and stuff. Whatever job you get into it. Try to explore even other opportunities. Try to learn new things. So that's all I have to say. The only true wisdom is knowing that you know nothing. So if you know nothing, you will always have that interest to know more things, and it will help you to learn more. So yeah, you can find me. I have a YouTube channel, Pharmacist Point, and I have a very active LinkedIn profile. So any help, if you want to know about any foreign licensure exams, or if you want to know about any job opportunity, anything related to drugs or disease, you can ask me. I'm always available. That's all. I hope this was informative. So like if you have any questions, you can ask me.
Hello, ma'am. Good evening, ma'am. This is Sai Sri.
Okay. Hi, Sai.
Ma'am, I would like to know about I would like to know how you published your articles, ma'am. I mean, in during in college years, uh, we don't have much access to websites to publish the articles.
Okay. See, if you go search in Google UGC approved articles, if you type UGC approved articles, you will get a set of articles even in from India. So it need not to be some high impact fact. Look, the articles which I publish are not from high impact factor journals, but they are PubMed index journals. So you can just search for UGC approved pharmaceutical journals in your Google search engine. So when you type UGC approved, you will get a lot of websites where you can publish your articles. So that's how you find out. Just search for UGC approved journals related to pharmacy. You will get many of them.
Thank you, ma'am.
Hello. Hello. Hello, good afternoon, ma'am.
Yeah, hi, yeah.
Yeah, ma'am, I would like to know that for dilutions, which guidelines or what material did you refer? Because I found a
It
bit difficulty to find the right dilutions. So can you please suggest something for me that to refer for that?
Okay. Look, it depends upon what kind of drugs you're like, what kind of drugs you're looking for. There are lots of websites. So, like CCOM is one website which we have reference, and you can search for. We follow US guidelines. So, as I showed in my presentation, there are a lot of US guidelines. You can check that for your for getting to know the IV dilutions. Go for US guidelines. If you want, you can refer other guidelines to compare, but mostly US guidelines are preferred.
Thank you, ma'am.
Okay. Okay. Somebody asked me what is my role in my research project. See, so I am the one. I am the one who collected blood cultures. So I think literally I have collected 5,000 blood cultures. So my job is to collect blood cultures, and then we have a set of guidelines in our project. So based on that guidelines, we detect hospital acquired infections. So for hospital acquired infections, there is a set of guidelines. How do you track hospital acquired infections? So based on that, I collect hospital acquired cases, and each and every case is read in details, because in detail from the date of admission till the patient got discharged. We have to read the whole case sheet to find out from where did this organism enter, or where did this pathogen enter in the bloodstream. So detailed case analysis is done, and then I discuss it with the doctors. So after their discussion, the cases are finalized, and based on that we have some scaling and scoring done whether this could be preventable or not. So basically, what to say is that whole project is done by me. Just discussing it with the doctors will help us to know that whether what we have done is right or wrong, and to identify the source of infection. Okay, look, internship. See, internship year, what I did is, so somebody asked me how did I start learning in internship? See, internship years, I don't know, I just started, because literally I didn't have anything to do that time. I told you that clinical exposure was very bad for me. So what I did is I started learning, simply just took a book, started learning in different ways. Then I thought like, okay, I'm learning something and I can make that thing into simple points. So why don't I make some presentation or some infographic and post it somewhere? So I just thought like, even I won't forget, and if anybody else is reading, it will be also helpful for them. So that way I started making infographics and posting in LinkedIn. So that is somehow, that way I got a very good reach and all that. But even it also made me like, it also motivated me to learn more and try to find out points which are easy to remember and all that. So during internship years, I was really spending my time on this learning. Okay, see, remembering doses of drugs is something. Wait, questions from YouTube. Okay, remembering doses of drugs. Look, unless and until you have a practical experience, it becomes difficult to remember doses. You can't literally sit and by heart each and every dose. If you ask me some dose, maybe even I don't know. But if you ask me some TB drug dose, I will know, because why? I'm working on it. I'm working on TB prescription, so I know, okay, this drug is this dose, because it's fixed in my mind. So once you have that practical experience, don't worry, you will start remembering doses of drugs. So initially try to learn some important doses, and again, you can't cover all the drugs. So if you have that practical experience, it will be more easier for you to remember the dose of drugs. Oh, do physicians and residents apply in acknowledgements? Do they take our suggestions and consider? Okay, look, this hospital is very, the doctors are really good. Most of them are really helpful. They know our value. Actually, they know clinical pharmacist value. See, whatever recommendation or intervention we provide, they trust us. Look, to gain that trust is something different. That's why I told you, read articles. So if there is some dose error, you can stand up to a doctor and say, look, doctor, there is this article or this guideline has shown that this dose is enough for this patient. What do you think? And just give them that reference and all that. They will start trusting you. You have to be assertive in whatever you say. Never give an recommendation with so much doubt. Always, when you say something, be assertive. Say it strongly. Don't give any doubt, and give your answers with proper references and all that. So actually, here doctors are very friendly. They understand us, and they also, even if we do wrong, they also tells us about it. So most of the doctors are really helpful. It's like a healthcare team. We have to even work with nurses. We also have to deal with nurses. So it's like a healthcare team, which you have to communicate with all of the people who is involved in that patient care. If we are interested to develop certain guidelines like antimicrobial resistance in your hospital, what we have to do to get those into practice? See, first thing is that you will have to track down all the blood cultures and all the antimicrobial agents which is prescribed in your hospital. Then you will get an idea about the prescribing pattern in your hospital. So that's what usually we do. You have to track down all the antimicrobial drugs, especially reserved antimicrobial drugs, like how it's prescribed, which is the common drug prescribed. So in such a way, if you have that kind of information, this will help you to refer other standard guidelines and develop guidelines based on that in your institution. So this should be done along with the help of physicians. So you need the help of a doctor for this, but what you can do is you can track down all this, and also this culture and sensitivity pattern of the common pathogen which is seen in that particular hospital or surrounding. So based on all this information, only you can develop some guidelines by referring standard guidelines. Okay, I think that's all. Okay. Okay. I think fellowship is something related to research. It will help you if you're doing like, if you're involved in research, like if your plan is to work in research, it will help you. If you have an interest in research, I think fellowship is research. And I don't know how I don't know whether Indian fellowships are recognized. I have seen this internationally. There are a lot of fellowships, but how much value will an Indian fellowship will give you in part if let's take oncology or anything? I don't know how much value it's going to give you. But if you're interested in research, like after fellowship, if you're planning for PhD or anything, it will be helpful for you.
Hi, ma'am. Good evening.
Yeah, good evening.
Ma'am, can you share how your interview went at Amrita Hospital?
Oh, okay. Look here, what they did is they already had resumes from their own students, and I just sent my resume with them. So initially, they just select the person internally from their team itself, and then my interview actually was with the medical director. I was selected, but I didn't know this was the way. So he just asked me about my interest, what I'm interested in about my work. But he was impressed seeing articles published. So that's one thing which he was impressed. Okay, you got these 3 articles published. Wow, that's the impression he gave me. Then he just asked about my research interest, whether am I interested in antimicrobial stewardship. Only like such, it was a formal talk, nothing like related to, he didn't ask anything related to drug. He just asked about my interest and all that. That was my interview. It need not be same in all hospitals. It's going to be different. For some of my friends, they asked drugs and doses, but for me, it was very smooth because they had already selected the candidate.
Okay, ma'am. Thank you. Ma'am, can you share what are the activities you carry out in hospital?
Yeah, so whatever I said, right, like protocols and guidelines, we prepare protocols and guidelines. We're referring to international guidelines. This is one thing. Then I told you we track hospital-acquired infections. So this is like institution-based, tracking hospital-acquired infections, checking for blood cultures, whether it is central line associated or catheter associated. So we track all that, and we present these data to our doctors. We give presentations to the entire healthcare team. The nursing department will be there, the doctors will be there, and we discuss our findings with the doctors, and it really helps even them to understand what's happening, and also optimizing the use of antimicrobial agents in the hospital. So these are the activities we do. And I told you, right, antimicrobial stewardship is very strong in our hospital, and it's really actively going on. So it has helped. You can search for articles, antimicrobial stewardship in Amrita Institute. You will see a lot of articles where clinical pharmacists have written all these articles regarding their work. So it has even helped us to reduce the cost of antimicrobial agents. It has reduced the DDD, that is average consumption of an particular drug. So, higher antibiotics has started being used with lots of caution. So now you can't say here, no doctor can prescribe a high reserved antibiotic without proper indication. So we made it in such a level that they have to give that antibiotic if there is proper indication. So basically, we have an administrative role, we have a quality improving role, we have a research role, we also do a traditional role of clinical pharmacist too.
Thank you so much, ma'am. Your presentation was so helpful for us.
Thank you. Yeah, so there was a question like regarding the habit of reading article. Okay, look, you have to let it be a book also. You have to start reading them, reading articles. As I said, look, when you study something, that's how I developed. Like, nobody's going to give you an answer if you like search, for example, why doxycycline cause photosensitivity reaction. So this is something which is fixed. We learn like that. We just by heart. But what is happening? Why does doxycycline cause this? So if you go search textbooks, you're not going to get that answer. You have to search articles, then only you will get that answer. So if you try learning things by thinking deeply, like how and why, all that mechanism behind it, you will start developing that interest of reading and finding out. You don't need to read the entire results and everything is, that's why an article has something called abstract. You just have to read an abstract to understand the entire article. That's why we provide abstract. So even reading an abstract is enough for understanding. You don't need to sit and read the whole thing. Look, I told you, right, during even my, the best thing is that during, after my project, our project guides, my sir, he really motivated us to publish. He told that you have to publish. It was a rule like for Kerala University of Health Sciences, you need 2 publications if you have to present that project. So due to that strict rule, we had to publish. But we was really going mad regarding publishing article. But we had to publish, and we searched for. They also guided us in finding journals. So this is how you find type UGC approved international pharmaceutical journals. You will get a lot of journals. It not need to be like high impact factor and all. Just go for PubMed index journals or Scopus index journals. That's more than enough. That's how you publish an article. And if you're planning to publish, for example, I'm planning to publish an article in BMJ, British Medical Journal. So what I do is, first I search for a journal which is published in British Medical Journal, and I read it, the way how they have written everything. So once you read, for different journals, it's going to be a different way. Usually the general things are same, like introduction, methodology, that's all going to be same. The way of writing will be different. So when you read these articles, you will get an idea how to write your article, how to write a manuscript and publish. So in any way, you will have to read. Without reading, you will not get an idea how to write a manuscript or how to publish. So you have to read articles. This is actually a very good, like your internship years now with lockdown, this is a very good opportunity you can use to read articles and learn a lot of new things. And if you're fifth, like usually we in fifth years, what they do is, if they, I think they, yeah, we do project in fifth year, right? So most of them have no idea what to do as a project. We go for suggestions. We ask the doctor like his interest. What is the doctor's interest to do? What are you interested in? Actually, you have to find your own interest. Like for me, we already planned that we will do something related to obstructive lung disease, but we didn't have any idea like what to do. Then our sir suggested you go for pharmaceutical interventions. Okay. Then what we did, we added more. We added medication adherence. Let's check medication adherence of the patient. Let's check the quality of life, whether it improved or not. So this is something which we ourselves found out from our project. So try to find out your research interest. Don't go and ask your professor's interest. What is your interest in doing the project? See, if you do, my project was really tough for me. We had a lot of objectives, but I really worked hard for my project. That's why I think I'm capable of handling the projects which I'm doing in my work now and writing manuscripts and all that. So even trying to find a project, you have to try to work, read articles, then you will find an interest on topic, like what to do, what kind of project you want to do. So for fifth years who are planning for projects, try to develop that research interest and find topics for yourself. So don't ask doctors to give their suggestions. They will have a number of suggestions for themselves, but try to find your research interest.
Any more questions to ask, ma'am? Hello.
Ma'am, good evening, ma'am. So, according to you, what are the key points we should consider while selecting a project topic?
Yeah, that's what I told you. You have to read articles, you have to read different manuscripts published, different articles published. When you read them, you will get an idea of how to find out a topic which interests you, or I think you will be doing in a team. So you have to read. Without reading articles or without getting exposed to these articles and manuscript, you will not have no idea how to do it. Like nobody can suggest you like do something on this. You have to read them, then only you'll have an idea how to do this, how to get the results done, what are the tools used for, let it be like quality of life, what tools we can use to assess the quality of life. So this all information you will get only if you start reading articles. Just type any topic you're interested, and just type any adverse drug reaction about a drug. You will get so many articles regarding just one area. Why did that happen? What is the mechanism? So any topic you write, just write a drug name. You will get so many articles just focusing on that drug. So if you're interested in disease, just write the name of the disease and search for articles. You will get different type of studies just focusing on that particular disease. So without reading and referring manuscripts, you will not get an idea how to select a good project. And you can also refer projects like yours, what others have done, just for like and to get an idea. But ideally, I would say read articles and read manuscripts. So this is like very important. Read articles. That's the main thing. That's how you find out what will you be able to do as a research project.
Thanks, ma'am.
Thank you.
Any more questions? Hello, ma'am.
Yes, yeah.
Yeah, thank you so much, ma'am. It's really very wonderful session.
Thank you.
I can see some questions.
Okay. I think you need an approval from ethical committee of the hospital because it's related to a patient. A patient is involved, so you will need an approval. You will have to talk about this with the help of a doctor. You can talk about there is a institutional ethical committee for every hospital. You have to talk about this and publish a case study.
So here I would like to give word of thanks. Thank you so much, ma'am. It's really very informative, and really means it's a new term that we get to know, that anti-tuberculosis treatment stewardship. It's really very new thing for us, and the take-home points is like we get to learn the simple ways of learning. And I always used to think like how to be in a research and also being a clinical pharmacist. You really gave us the hope and the so this can also be possible. And yeah, I personally watched the YouTube videos that you shared, and it's really very beneficial. And yeah, thank you so much, ma'am. Thank you so much.
Thank you all.
Thank you, ma'am.